Sounds good. All right, welcome everyone. I'm Dr. Javier Sanchez, and I'm the program director for the Climate Health Action Coalition here at the Inland Empire. We'll welcome you once again to our webinar series. This is session 4. We've been very fortunate that in the past 3 sessions, we've learned about the climate change and the extreme weather patterns that we're seeing. Our second one, we had the opportunity to learn about how we can talk about climate change to the general population and to healthcare providers. And our third one, we learned locally here at some of the economic impacts of climate change and what we can do to be able to mitigate some of those changes that are going on. Today, we're very, very lucky to have 3 speakers who are going to talk to us about the local efforts here within the county of San Bernardino and the county of Riverside County. Before I pass it on to Allison, I just want to acknowledge our heartfelt sentiments that we have for everything that has happened here in Southern California with the recent fires here in Pacific Palisades and Altadena. Like you, I have colleagues who have lost their homes. I have friends who have lost their homes with this. This is so unexpected, but again, with this extreme weather changes that we're seeing because of climate change, this is something very, very important. So I'm happy that we're having the opportunity to do this webinar series so we can continue to educate healthcare providers, local leaders, business leaders, everyone who wants to learn more about climate change. So with that said, let me introduce Allison Elsner, our CEO of the San Bernardino County Medical Society, to take over and present our speakers.
Thank you so much, Dr. Sanchez. And I want to first of all thank Dr. Sanchez for launching and directing this entire program in this series. I also want to thank Dr. Sanchez for just being the visionary behind this. And I want to thank our partners in the coalition, the IECHAC, which is the Inland Empire Community Health Action Coalition. So we do want to thank our partner, Riverside County Medical Association. I think Dolores is on the line with us today. And we want to thank Riverside University Health System, Public Health for Riverside County, as well as San Bernardino County Department of Public Health, who are all partnering with San Bernardino County Medical Society. So that's our coalition, and we're excited that we're hosting a conference on May 30th. We have been sending out information on that, but we will get you more information as our speakers get locked in. It's going to be a really exciting day from 8:30 to 2:30, held at the IEHP atrium. A huge shout out to IEHP for hosting us that day. And really quickly, I want to say belated happy birthday to Dr. Sanchez, our leader. Happy birthday, Dr. Sanchez. We're celebrating with you today.
Thank you so much. Thank you.
And
my 25-year-old.
Right. 29 again. And we want to thank also Loma Linda University Continuing Medical Education, who've been just amazing at partnering with us on this. So there will be CME, Continuing Medical Education, offered for this session. And following the session, we will send out the recording and the instructions on claiming your CME. Please be sure to put any of your questions into the chat feature on Zoom, and we will get to those after our presentations have concluded and our speakers have finished. Then we would love to hear from all of you. So with that, I'm going to go ahead and introduce our wonderful speakers today. First off, we have Shunling Tsang, MD, who currently serves as Deputy Public Health Officer in Riverside County. Dr. Tsang also serves as the Chair of Family Medicine and Medical Director of Ambulatory Quality at Riverside University Health System. Dr. Tsang completed her master's in public health with an emphasis in complex humanitarian emergencies at Boston University, her medical degree at St. George's University School of Medicine, and trained in family medicine at Riverside University Health System. Dr. Tsang has a passion for finding ways to partner with individuals and communities to positively impact overall health and foster community wellness in Riverside County. When Dr. Tsang is not working, she loves to travel, experience new foods and cultures, walk outdoors, discover new places locally and afar with her husband, 2 children, and her dog. All right. Also excited to welcome Stacey Davis, who is the Health Equity Program Manager at San Bernardino County Department of Public Health. Stacey has her MPH from UC Berkeley and will soon complete her doctorate in public health from Johns Hopkins. She has over 2 decades of experience working in local health departments and safety net care organizations, where she has developed a passion for leading efforts to support socially disadvantaged communities and cross-disciplinary partnerships. Among those challenges is supporting communities and organizations in preventing and planning for the impacts of climate change. And thirdly, today we have Juan Landeros-Tavera. Juan is the program director for the Climate Justice Program within the Epidemiology and Program Evaluation Branch at RUHS Public Health. With over a decade of public health experience and an MPH from Cal State University San Bernardino, Juan is committed to empowering communities to address climate-related challenges and achieve sustainable long-term environmental and quality of life improvements. So we welcome all 3 of you. We're super excited to have you here, and we will let you get started. I think we're starting with Dr. Tsang and Juan.
Yeah, I'll go ahead and share my slide deck real quick. Can we all see that?
Yes.
Is it in presenter view or are you seeing my notes?
Yeah, we see your notes on the left there.
Okay, so that's not the correct view. I mean, I wish I could get it right every time. It just never works out that way. Let's see. Okay, how about there?
Yeah, it says data priorities for climate action.
Yes.
Yeah, you got it, Juan.
All right, I figured it out.
Way to go.
So, hey everybody, I'm Juan Landeros-Tavera. I'm the program director with Riverside University Public Health's Climate Justice Program. RUHS is Riverside County. So we're the County Department of Public Health. So why climate change matters, right? We know climate change is happening. That's not a question. And we know that public health and climate change definitely intersect, right? And climate change really exacerbates the existing health inequities we see in our communities. It disproportionately affects vulnerable populations, low-income families, the elderly, children, communities of color. And it does that through increased exposure to climate vulnerabilities, to extreme heat, to poor air quality, and as we've been seeing, exposure to climate-related disasters. So Riverside County, in context, right, we see high rates of air pollution due to the proximity to freeways, warehouses, other industrial sources. We have frequent extreme heat events. We have communities where the heat island effect and insufficient tree canopy really increases those effects, making it so that those communities are hotter than normal. And then we have many unincorporated and underserved communities where we see disparities, not only in access to healthcare, but also access to things like cooling centers, green spaces, climate resiliency resources, right? We have communities where the homes aren't built with appropriate insulation. So all these things kind of work together to impact our underserved communities. And the goal of our program here with the Department of Public Health is to mitigate these impacts through targeted, equitable, and data-driven solutions, right? So I'll start off with the data priorities. Like it was mentioned, we're housed under the epidemiology branch with the Department of Public Health. So everything we do starts with data. So the priorities that we've set to look at, number one being outdoor air quality and health disparities, specifically in underserved communities. So looking at particulate matter and then assessing the impacts on health. Heat vulnerability mapping, very similar, right? Identifying populations most at risk, identifying communities that experience a heat island effect, and developing maps to show what communities are vulnerable and where we can have an impact. We are looking at indoor air quality and gas appliances. We know that there is a connection between indoor air quality, gas appliances, and asthma amongst children. So we're looking to identify the prevalence of these respiratory issues that are linked to gas appliances and put out data to support the transition to electric alternatives. We're looking at greenification and school-based heat mitigation. There was a very interesting report that came out. I can't remember the organization, but it was looking at tree canopy at schools, and the Inland Empire schools had very low levels of tree canopy, and the tree canopy is in areas that isn't necessarily useful to lower the heat that children experience while at school. And then wildfire risk, air quality, and resiliency planning. So looking at planning around air quality, wildfire risk, and our most impacted communities. So extreme heat. Riverside County faces rising temperatures due to climate change, right? The projections are scary. So these are based off the RCP 8.5 scenario, which is the business as usual scenario. And we're projected to have 80.5 days per year that would be over 100 degrees by mid-century, right? We're looking at 34 days a year over 101.8 degrees. And we know that these temperatures impact public health. They exacerbate cardiovascular issues, respiratory issues, renal issues. And then in the communities with low tree canopy, the urban heat island effect really amplifies the issues around extreme heat. We know that these extreme heat impacts tend to affect low income and communities of color more. Generally, they live in areas with fewer green spaces, inadequate housing, limited access to resources. These include communities that are outdoor workers, farm workers, and right over here, you can see this is from the Healthy Places Index. It shows the projected number of days that Riverside County will face over 90 degrees, which is at this point a third of the year, which is kind of scary. And these are all based off of the business as usual projections. Here's just a visualization of what we're looking at for extreme heat in Southern California, which I think shows how important it is for us to collaborate and work together with different jurisdictions and community-based organizations to address the extreme heat in our communities. Also from the Healthy Places Index, if anyone wants to look that up. A part of what we're doing with our data team is we are putting out reports on the intersection between extreme heat and cardiovascular. This one right here is heat-related emergency department visits by temperature. It'll be updated in spring 2025, but you can see the clear connection here between the days that we see the most extreme heat and the amount of emergency department visits that we see during that time period. These are the demographics we see on ED visits due to extreme heat. As you can see, the 35 to 64 population tends to be the majority there, and I'm 37, so I guess I'm in the high risk group for heat exhaustion. When we look at heat related deaths, you can see that connection as well, right? As when temperature is the highest, we see the most heat-related deaths in our communities. And this, you see a similar breakdown, although you can see how some of our older population is more susceptible to heat-related deaths. And this is all on our our heat related dashboard we have online. If anybody's interested, let me know and I can provide you the email address. Not email address, the website. Wildfires, right? This is something that I think we're all too familiar with. We know that wildfire seasons are expected to be longer by 2050. And we're expecting 2 to 4 high fire years by 2050 instead of once per decade. So that's an increase in the amount of fire risk that we're going to be seeing in our communities. And that has to do with, climate change, rising temperatures, drier forests, and conditions that just create an opportunity for very dangerous and extreme wildfires. Once again, there are equity impacts to this, right? Populations with underlying health conditions, heightened exposure, outdoor workers, homeless folks, people who are low income or undocumented, farm workers have a higher rate of exposure to toxic air quality and particulate matter. And we know that there's an interaction between extreme heat and air quality. So, particularly near freeways, warehouses, high heat, we usually see elevated levels of ozone and particulate matter during high heat days. So air quality and high heat days kind of come together. And this exacerbates respiratory problems, especially amongst children. We also know that long-term exposure to particulate matter is linked to cognitive and developmental impairments among children. And the impacts we see from these issues are disproportionate amongst some of our most vulnerable populations. We know that this is also tied to environmental racism, right? This is a little graphic from The Nation. It shows that race is a significant predictor of a person living near contaminated air, water, and soil. Right. So our communities that are disproportionately impacted are communities of color, low-income communities, disabled communities, outdoor workers, immigrant communities. Here we have this is archived data from airnow.gov on air quality and the air quality sensors in Riverside County. Right, as you can see, red's not a good color. Red usually means toxic air quality. Yellow and orange, not great. Green is better, but you can see that there are definite communities that experience worse air quality regularly. And then there's also, from what I see, gaps here, right? This whole kind of area here doesn't seem to have any air quality monitors, even though they're next to major roadways, and the logistics industry is situated heavily in this area of Paris, Menifee, Moreno Valley. We also know drought affects it. As of October 24, we're experiencing a moderate to severe drought. And we know that these water scarcity issues not only affect people's health, but it also affects economic productivity and people's ability to work, specifically those who work in agriculture. I like this graphic here from IECHA. I think it sums up exactly what climate change effects we can see in public health, right? Rising temperatures, extreme weather, air quality, increase in vector-borne diseases. We see the secondary effects, right? We're seeing it firsthand right now with the fires, the property loss, the infrastructure damage, intense wildfires. And all of those are linked to health effects: heat stroke, dehydration, cardiovascular illness, waterborne illnesses, etc. All right, so here's the good part. It's what we're doing in Riverside County. So one of the issues that I see from a program perspective is that a lot of our climate work is spread out through a variety of different county departments. It's not just centered in public health. So our Riverside County Planning Department are the ones responsible for adopting and implementing climate action plans. Um, the climate action plans, the one that was released in, I believe, 2015, looks to cut greenhouse emissions by 15% by 2020, 49% by 2030, and 83% by 2050. The cap that the planning department has put together is in alignment with state climate change regulations that the state of California has passed, including Senate Bill 32. It includes provisions for regular updates so that as new technologies occur, we can not only assess our greenhouse inventory, but update those plans. There is currently a cap update in progress. The planning department will be starting listening sessions soon with the community, and the greenhouse gas inventory for this next cap is in progress right now. We also have the climate work that Housing and Workforce Solutions does, right? They have received some funding from the Department of Energy to support their weatherization and home upgrades programs, where they work with underserved communities to weatherize their homes, whether it's installing electric alternatives to gas furnaces, gas stoves. They offer utility assistance, especially for communities that are overly impacted during extreme heat events and cannot afford to run an air conditioner as often as some of us can to keep their homes cool. And we also operate warming and cooling centers because it's winter, even though I think it's 80 degrees today. There's a map here of all the warming centers we have throughout Riverside County that the Housing and Workforce Solutions sets up every winter. We have our public health emergency response program, which is different from our EMD program. So their focus is on disaster preparedness, setting contingency plans for floods, drought, heat waves, wildfire response. They collaborate with our EMD department as part of the MOAC. They have ensured that 700 of public health staff have been trained in emergency management so that they can be easily mobilized during an emergency. They provide general population shelter training so that public health staff are prepared to connect individuals to resources in emergency shelters. They develop and exercise emergency plans with the different county departments. Recently, they've been looking at public safety power shutoff plans. Right, the power safety shutoff happens when there is a risk of a fire, people's power gets cut, and we know that there are people who have issues around keeping medications and food cool during those times. So they really collaborate with the different departments to address some of these equity issues we see around emergency management. And the work the Department of Public Health is doing, we have the Clean California Local program. It's in the Eastern Coachella Valley. We partner with a lot of community-based organizations to increase shade coverage, enhance public spaces, improve canopy, green spaces at schools. We collaborate with Konkui Design on their Shade Equity Master Plan, which is targeted in the Eastern Coachella Valley, and it seeks to address shade access and resilience to extreme heat. We launched the Blue Zones initiative. And then our Safe Routes to School program really works with school districts and individuals to promote walking and biking routes to school, encourage physical activity, and reduce air pollution. We have just brought on a Civic Well intern into our program to help us with a vulnerability assessment. So they're going to be looking at our most vulnerable underserved communities, identifying vulnerabilities, and then we're going to be working to put together a plan on how the program can address those vulnerabilities. We're also looking internally. We're creating a climate justice training module that's a part of our Improving Health for All module series to enhance staff's understanding of climate change and equity and climate justice. That should be implemented within the next year, I believe. Here's a list of the community-based partners we work with in some of these climate spaces: Concui Design, Building Resilient Communities, The Living Desert, Líderes Campesinas. Some of the projects we work on: the Shade Equity Master Plan, Clean and Beautiful Resilient Oasis, and then we have the Health Equity and Justice Task Force. We also collaborate with cities. We're working with the city of Riverside on their community or their climate action plan. Launched fall 24, expected to conclude by 2027. And we're part of the subject matter expert team for that. Path forward, right? As our program expands, we want to expand our climate justice initiatives. We want to engage deeper with community. We want to continue collaborating with our regional partners, looking for funding for mitigation and education projects, and really kind of expand the access to our climate data dashboards. And just to be conscious of time, I think I'll pass it over to Dr. Tsang.
Thank you so much, Juan. If it's okay, I'm going to try to share my slides too and build off of what Juan was sharing. So let me see if I can make that happen. Hold on. Okay. Can you see my screen?
Yes, looks good.
Fantastic. Okay, great. So I'll pick up where Juan left off. So again, my name is Shunling Tsang. I serve as our Deputy Public Health Officer here in Riverside County, and excited to talk about this topic and pick up again where our efforts continue around climate health. And I think I love this series, and I think the teams that have brought this together. I think Dr. Sanchez and Riverside County and San Bernardino Medical Associations for helping us really bring this to our providers. I think this is an important topic as we think about its impact on our patients, the care that we provide our population, and how we want to think about planning, right, over the next years to hopefully reduce, I think, the wildfires and things that we're seeing throughout. So with that, I'll jump right in. Hopefully you can see my next slide. So just to talk a little bit about Riverside University Health System Public Health, and as Juan shared, we are Riverside County Public Health. We're synonymous. We do have a lofty vision to be the healthiest county in the nation, and our mission is to meaningfully enhance and extend life for all in Riverside County. And if we think about this in light of our theme today around climate and climate change, we can't do this unless we're able to impact all things that impact health. So one of the things I'll talk about, and you heard a lot from Juan already around all the different activities that we're doing in public health. There's just, large partnerships that are happening with our teams to ensure that we are looking at it holistically from a public health lens when we work with our partners to bring, the best strategies forward for how we can impact climate. I'm going to talk to you about one program within that larger group of programs, which Juan mentioned briefly, which is Blue Zones. So some of you may not know Blue Zones or may not have heard of Blue Zones. Blue Zones is the ultimate example of existing communities in the world where people have lived longer than anywhere else on the planet. And National Geographic essentially conducted research studies with demographers, PhDs, explorers, to figure out why those blue zones were blue zones, and then from that came something called Blue Zones Project, where we're trying to figure out how we could now successfully reverse engineer Blue Zones concepts or those common findings into our communities. And the Blue Zones Project uses, systematic processes to empower everyone everywhere to live better longer. So I'll tell you a little bit more about that and how that impacts climate. To talk a little bit more about blue zones naturally occurring in the world, this is a map showing you where they are. We have one in our own backyard in Loma Linda, California, and then you can see they're scattered throughout the world. The one new one that was announced recently on a Netflix special, if you guys watch, there's a whole Netflix, if you want to binge watch something, that might be something fun for a binge watch on the weekends. But there's a Netflix special on blue zones, and it gives you a little bit more insight and detail. But they've shown that Singapore was able to successfully reverse engineer health and wellness into their community as they've developed in this little tiny nation, and has been able to show blue zone-like outcomes. And so, that's why they're called out on this. The common things they've found within all of these communities, they call that the Power 9. And it boils down to, are we moving naturally? Do we have the right outlook? Are we eating wisely? And are we connecting with our neighbors, with our loved ones, with our families, with our friends? And so, even though it's broken out into these themes, this is what the research has shown have impacted those communities to have that longevity and to live better longer. So 9 commonalities, 5, themes, if you will, here around how to, what's the secret sauce to long, happy lives. And it's summarized into something called the Power 9. And I'll talk about that a little bit as we kind of go into what that Blue Zones project will look like for us here in Riverside County. So as Juan shared, where we live very much impacts our health and well-being. And sometimes we can't necessarily control where we live and what lives with us in the same surroundings, right? And so, when we think about the life radius, most of us spend 90% of our lives within, a small radius. Some say 5 miles, 10 miles, but it really is a small radius where it's close to home. And that's what we call our life radius. And that's where we, tend to do our shopping, where we try to do outdoor recreation if that's available to us, or where we don't because it's not available to us. But the environment significantly shapes and impacts our overall health and wellness. Genetics is only a small portion. Access to care, so I'm a family doc by training. Most people see me 20 minutes, maybe twice a year if they're lucky, right? So the rest of the health and wellness happens in community, and how our environment and healthy behaviors are available shapes our overall health and wellness. So we're bringing Blue Zones initiatives here to 5 communities in Riverside County. You can see it on a map here. So the city of Riverside, the city of Banning, the city of Palm Springs, the city of Coachella, and the community of Mead Valley we are all in the process of launching Blue Zones transformation projects. We've done our assessment. We've worked with the cities, and now we've hired executive directors in each of the communities in partnership with Blue Zones. We found sponsors to sponsor this work, and you can see the sponsors along the bottom there. There's a shout out to our sponsors who've made this possible. And these projects last anywhere from 3 to 5 years. And the goal is really to work with local leaders. So we hire locally and we train locally to keep that talent in the community, and hire local people to do that work every day to see how we can improve community wellness, engage our communities to do that grassroots work. And the beauty of Blue Zones is the measurement piece of this. We're able to measure meaningful change year after year based on Blue Zones projects that have happened in 70 other communities in the nation. So what is the Blue Zones work, and how does that impact climate health? The Blue Zones really looks at 3 areas: people, places, and policies. And so when you think about people, places, and policies, what are people doing and what can we do within our control? What's that in our home? What do our social networks look like? What is our purpose? What wakes us up and keeps us going every day? The places looks at the places that we move within our life radius. So looking at stores that are within our life radius, workplaces, restaurants, school, faith-based. And then, of course, policies. And Juan talked a lot about the policy side. Public health does a lot of work around policies, especially around food systems, tobacco, built environments, and alcohol use. So that is, in a nutshell, what the Blue Zones Project is looking at as people, places, and policy, and how can we impact that at a community ground level to then impact health and ultimately also impacts climate health, which I'll go into now. So Blue Zones and climate health. So with people, when you look at Blue Zones and the work they do, they encourage whole food, plant-based diets. If you do that and you're eating less meat, it actually reduces greenhouse gases. 60% of the 34% of overall global greenhouse gases comes from livestock. So our cows and our steaks, my husband loves steaks, and so I'm sure he's not happy when I share this, but thinking about not totally moving to vegetarian diets, but really thinking about eating meat in smaller amounts and really focusing more on whole foods and plant-based diets rather than processed foods. Lifestyle changes. Are we walking? Are we biking? Are we moving naturally to reduce our carbon footprint? Are we connecting to our local environment? When we go outside, do we have the tree shade canopy that Juan was talking about? Is that something that our communities want, which I argue would be yes? And how can our communities come together to advocate and bring this back into their communities? Strong social networks and sense of community also helps to bring communities together for well-being, and that translates to overall volunteer opportunities and maybe facilitate networks, which could, again, that promotion of healthy lifestyles tends to consume less energy, generate less waste, and really have that collective look at a community and how they can improve overall community places. So looking at our built environments, improving walkability, bikeability, public transit, increasing green spaces so that people can recreate together with the people, right? And coming together to walk. So they have places that they can walk. Reducing air pollution, which could result in cleaner air because we're not driving everywhere. 40% of emissions comes from transportation. So if we're using our two legs or a round wheel with no motor, it's actually reducing our 40% of those emissions that's coming from transportation, which will translate to cleaner air. We reduce energy consumption and we promote climate resilience. And again, having built environments that are friendly to natural movement also creates more community. And that's part of our the Blue Zone's secret sauce too. I just wanted to share this one paper from 2008. So now we're talking about a paper that was very forward-looking, right? And it was through the American Journal of Preventive Medicine, where they said working across sectors to incorporate a health promotion approach in the design and development of built environment components may mitigate climate change, promote adaptation, and improve public health. And in here, they talk a lot about what Juan talked about, and what the Blue Zones activities is trying to do is really build that community to mitigate the issues we're seeing currently in climate change. And how do we reverse some of that through thinking about built environment? So that's the last thing within the Blue Zones, kind of the three things: people, places, and this is the policy side. So what are we doing within the Blue Zones project? Includes looking at food systems, promoting more whole food, plant-based access to food, which again would reduce those global greenhouse gases from the meat-based foods that come. And again, the goal is not to reduce all consumption of meat. I think it's a balance, and how do we want to shift that balance so that we are enjoying our steaks as a celebratory, but our daily consumption of food is more plant-based. Also promoting urban agriculture, so improving local food chain distribution. A lot of us we're really lucky here in Riverside County. We have agriculture in our county. How do we utilize the agriculture that we have so that we're improving the local food chain distribution and promoting, again, more whole foods? And then focusing on permanent and semi-permanent changes that then promote climate resilience. And so that's part of the Blue Zones project work that's happening now within each of those communities around people, places, and policy. So the anticipated outcome of the Blue Zone's work on climate health is improve community health and wellness, which we shared. And some of the outcomes, I just want to share with you two examples of communities where Blue Zones has worked, where they've been able to show pretty impressive outcomes. So as I shared with you, the Blue Zones project is not new nationally. There's 70 other projects happening. We are the latest ones to join this effort to think about how do we do this work within Riverside County so that public health can meet our mission and vision to improve health and wellness. Fort Worth, Texas adopted this in 2014. And they, since 2014, since implementation of Blue Zones, they've been able to measure a 31% decrease in smoking, an 11% decrease in high cholesterol, and a 40% increase in exercise. And what that translated to after 4 to 5 years of Blue Zones, and they're continuing that work within the city to this day, they were able to see their health rankings for large metropolitan cities move from 185th out of 190 to now in the 50s, which is amazing. And that measurement piece is why we were so drawn to Blue Zones, because we can use the methodologies to show that we're systematically improving health outcomes within the project itself. And that's always something public health is looking to do, is to measure. The beach cities is another one. So that's in our backyard as well. So it's the beach cities of Manhattan Beach, Redondo Beach, Hermosa Beach. And they started their project in 2010. And they just published their latest outcomes, which is really exciting. So you can see they continue to show that the changes they made are permanent, semi-permanent, which have lasting impacts. They're 15 years in now. They saw a 25% drop in overweight adults and a 65% reduction in childhood obesity, which again translates to healthier people who live within that community. If we're able to increase health and wellness, we'll see a decreased healthcare costs, which some of us may not think about this, but our hospitals, our clinics, our medical waste also creates a carbon footprint. So just for medical waste, it's a 4% carbon footprint that we're putting out into the world. And so if we're able to decrease healthcare costs and we're able to improve health and wellness, hopefully less people will have to go to hospital. We can take care of them in the clinic, reduce our overall carbon footprint from the healthcare industry by reducing the amounts that we produce there. We can also increase economic productivity, because if people have a sense of purpose and if people have a reason to wake up every day and their health is improved, you see less absenteeism within the workplace, which translates to increased economic productivity. And ultimately, we'll see reduction in chronic disease like diabetes, hypertension, obesity, which then leads to, again, additional costs. So I'm going to end here, but I wanted to leave our team with a small call to action. So small changes can have a huge impact on climate in a positive way. So we're doing all these large projects and programs, but I think we as individuals have ability, right, to change things for ourselves and what is within our sphere of control, and what can we do today to make a small change in what we do. Can we walk more? Can we bike more? Can we maybe eat more whole food, plant-based diets so that we can make a small impact in climate? And collectively, that'll have a large impact as we move forward. So with that, I'll stop and say thank you. If you have any questions, you can, or if you have any questions about our Blue Zones projects, I left some links there and I can share that with our sponsors today. And I'll hand it back to Allison. Thank you.
Thank you so much, Dr. Tsang and Juan. That was just awesome, including our call to action. We'll take that seriously. Thank you. Stacey Davis, we would like to welcome you at this time.
All right, thanks everybody. Thanks to the Riverside colleagues for sharing such a thorough background. I think we're thinking a lot of the same things, and so I thought I would like to share. Thought I would share with you all a little bit about how San Bernardino is starting our climate journey, and talk a little bit about what we're envisioning for the future. So I'll just kind of briefly look a little bit at some of the things that we're doing internally. some of the things that we're starting to do externally outside of the health department, and then talk a little bit about data. So Juan shared a lot about what Riverside is doing in terms of building capacity and really thinking about working with communities. And there's one of the reasons you'll notice that we don't have a climate program per se. Climate work right now essentially is embedded within the health equity program in the San Bernardino County Health Department. And you heard a lot about the reasons for that in the data and the vulnerable populations. The impacts of climate change are disproportionately experienced by historically marginalized populations. And so we're also kind of perceiving and thinking about climate from an equity perspective. And so one of the things that we're trying to do, because this is an emerging public health issue, is to build some internal capacity within our department and really support that kind of work. So along with Riverside County and several other Southern California jurisdictions, we're a part of the Public Health Alliance Climate Accelerator. And one of the things that we've all expressed a need for is to build some internal capacity and knowledge around the health impacts of climate change and specific strategies to integrate some of that climate resilience planning into the work of public health programs. So we're doing that now. We're going to pilot the basically a climate change 101 with our staff. And we're hoping to build that capacity and really work with them and have our program serve as sort of internal consultants to help them identify specific strategies to incorporate this work into what they're already doing. So for example, we have public health programs that are focused on doing home visits to check for lead exposure in young children. Folks who are already going into members of our community, our residents' homes, could also be checking for things like, do you have a source of cooling? If not, do you know where to go? Do you have issues with paying for utilities? Do you have screens on your windows? So things like that. So integrating that work into some of the things that we're already doing is one way that we're thinking about approaching climate. Other ways, and Riverside has a great dashboard that they shared with you, is really enhancing our syndromic surveillance. So I'll talk in a minute about our forthcoming climate data platform that we're hoping could really be used by all of you and our other stakeholders to inform, some of this work. But one of the things that we're doing is really trying to think about how do we enhance our syndromic surveillance for heat-related illness. We know that's been our major, the major climate change that we've experienced in our county, in addition to some of the severe winter storms that we had a couple of years ago. But our syndromic surveillance system needs to be enhanced, and how we collect and use that data. And just going back to, Juan's comment about interoperable data systems and being able to pull all of that together so that we can then share it back out with all of you and the rest of our stakeholders is really important. So we're working internally on some of that infrastructure. I mentioned a climate data platform, and I'll go into a little bit more detail on that in a second, but essentially we would like to also provide real-time data, but also some projections of what we know are vulnerable populations to different aspects of climate change, so that you can see where those populations are located in our county. What does that look like now, and then moving into the future? For example, San Bernardino County is anticipating quite a large increase in our senior population over the next 20 years. And we know that population is already more vulnerable to the impacts of extreme heat, for example. So what do we need to do in terms of planning and preparing for those population changes? And then finally, of course, this is something that we're all trying to do, is work better together, not work in silos. Juan mentioned that this is sort of disparate work scattered throughout different county agencies, and the same is true for San Bernardino County. We're trying to really think about who are sort of the expected partners in some of this work. So for example, our Office of Emergency Services, our Internal Preparedness and Response Program, our Communicable Disease Program, our Vector Control Programs, and so forth. But who are some of the non-traditional partners that we might not think are doing direct climate work, but that would be serving the populations that would most likely be impacted by some of the changes that we expect. So we're really trying to work on strengthening and building some of those relationships as well. And then finally, just kind of moving into highlighting some of the external efforts that we're working on. So our Healthy Communities Initiative is going to release a climate resource webpage where we're hoping to link stakeholders to sample policies and evidence-based practices, ways that they can envision incorporating and addressing impacts of climate change in their communities. There is an existing extreme heat webpage for heat safety resources that's put out and managed by our preparedness and response program that has a map of cooling stations as well. So I will include the links in the slides when these get sent out. So really kind of pulling together some of those resources and increasing awareness of our partners of these resources. And then also, of course, because there is no current dedicated funding for climate specific work, we're really looking at a lot of the funding opportunities that are forthcoming, which require most of them partnership with community-based organizations or healthcare organizations or local government entities to pull down some of that funding and bring it to the Inland Empire to help build both our response in terms of mitigating climate change itself, but also supporting that climate resilience planning effort. So I've mentioned a little bit about our forthcoming climate data platform. So this is really an effort to bring disparate data under one umbrella, again, as a resource for our stakeholders and our internal partners. So, looking at climate indicators in our county specifically, so you can see here that we're looking at ozone days and PM 2.5 concentrations, but also extreme heat days and maximum temperatures and things like that, and looking at projections so that it's easily interpretable and our stakeholders can look and get a good idea of what we anticipate will be the changes in our county. Like I mentioned before, we also have some population projections that we'll be sharing there for those populations that we know are disproportionately impacted by climate change. And then we'll also be looking at several health indicators. Juan also mentioned a few of those, but for example, asthma hospitalizations or heat-related ED visits and things like that, where we can look at what's currently ongoing in San Bernardino County and where are those folks located to better inform more localized planning efforts. Okay, and then the other component of that data platform that I'm mentioning is also pulling together some of the more complex projections that are out there. So some of you may have heard of CalEnviroscreen and the extreme heat HPI page and several others. We're trying to pull all of that information together into one place so our stakeholders can easily access that. Okay, so I think that's just a very brief overview of some of the things that we're talking about in San Bernardino County. We're also thinking about, a lot of what Dr. Tsang was mentioning in terms of, community health changes and population health changes and how that can also have impacts on climate change. That will be integrated into something that we're currently proposing and thinking about in terms of a population health infrastructure. But I'm going to save further comments for another time, but happy to take any questions. Thank you.
Thank you so much, Stacey. That was great. Everyone, that was just fantastic. So we'd love to take some questions, folks, from some of you. I see there's a comment here from Ann Lynch. Generally, unless a project, housing, commercial, etc., is on federal land, local projects must comply with California law. Oh, are you answering my question, Ann? I asked a question: how are county action plans impacted by policies introduced or enacted at the federal levels? In other words, can we still make headway with climate protection rollbacks through the EPA? Would love your input on that to our speakers.
Yes, sorry, it took me a moment to figure out how to unmute myself. Generally, I'm an environmental attorney with a biology degree. I generally look at these impacts um, for municipal entities, county entities, et cetera. And California law, the California Environmental Quality Act, the state level protections for environmental impacts for sensitive, endangered, threatened species are generally pretty good. And in complying with California law, you may or may not have to comply with federal law, unless you're, sometimes federal law applies, but often at the state level or at the local level, you're complying with California law. And even if there's federal laws applicable, it's sometimes the standards are based on case law, based on the actual law and how it's been interpreted in the courts. Those requirements aren't as stringent. So I think as far as this, the question seemed to be asking, can we still make headway? Yes, we can, because most projects are under California law. Did that answer? Did that make it clear enough?
Thank you. That's really helpful. That's really good. And I'm even thinking about long-term climate goals and things like
will come up.
Vehicle restrictions.
Yeah, and my recollection in the past, and this is really just based on recollection, is when California first came up with its, hey, our vehicles have to be cleaner or get better mileage. There was some nervousness about whether or not the Commerce Clause at the federal level could prevent California from imposing more regulations. And I don't remember how it was resolved, but I think the automobile manufacturers decided it'd be better to just go along with California because big market.
Oh, I see.
That's just my recollection. I don't have the details. I could be totally wrong, but California does have that soft power advantage. We're a big state, lots of cars here. We have a car culture, so that's more of a soft power thing.
That's good input. Thank you. Thank you very much, Anne. Yeah, Dr. Sanchez.
Ms. Lynch, just to try not to get too much into the weeds of the law.
Great. That's all we got.
I just want to sort of get an idea from you and from other experts, because I've been asking this question. With the last year, with the Chevron decision from the Supreme Court.
The Loper-Bright case, is that what you're talking about?
In which they pretty much took away used to be in a way that the experts would be the ones who would interpret the law and would be allowed to sort of make recommendations as to how to implement the law. With this decision that happened last year, especially when it comes to environmental law, what do you see the impact of that?
I see the
especially here in California
so far, and it's too soon to say, but the Chevron deference actually has a lot of interesting backstories to it, and connected to the Loper-Bright case. The Loper-Bright case, for anybody who hasn't had to follow this, the way federal law is administered is the executive branch agencies have had the power to interpret and enforce and whatever Congress just passed. And we know we generally don't have technical, scientific, or any sort of expertise. Mostly it's lawyers in Congress. So much of that was deferred to the federal agencies to implement and enforce. And up in the Chevron case, which is from the 1980s, federal law, the federal court basically said, hey, you know what? If the executive agency made a reasonable interpretation, we'll defer to them. The Loper-Bright case, which is very recently passed, changed that and said, no, we don't defer to the federal agency. We will decide what the law means. And as Dr. Sanchez noted, that isn't where the technical expertise, federal judges generally don't have scientific backgrounds or the relevant technical background education to understand the details or make, so the outcome that I'm anticipating, and it's too soon to say, is that, and the incoming administration wants to, there's been some noise about eliminating federal agencies. I think there are over 1,000 and they enforce a lot of things. So in terms of what will happen at the federal level, litigation. People,
I see.
people will sue, you'll go to court and a judge will decide. And then you'll go back to court for appeals. That's generally what I see happening at the federal level. And again, so I think nationally, if you want to, and one of my passions is getting science into policy, work with the UC Riverside Science to Policy certificate program, is figuring out where the best place to do it. And it looks like state level is going to be the best place to put in effective requirements. But I don't know yet. No one knows yet, not until the lawsuits start flying. Have I babbled on long enough and bored everyone yet?
No, you're
Okay,
awesome.
For the colorful part, even if you go to a state legislature, and this is just for your entertainment, once upon a time, the Indiana legislature thought they would legislate the value of pi. Something more convenient. It didn't happen, but they worked on it. So things can happen, and a lot of that will depend on who gets elected in every state and how they view science and technology.
I have a question for those of you for the county level. As we look and hear more about the fires, both in Pacific Palisades and Altadena, and some of the preparedness that LA County had or did do or didn't do, now that this is very real for us and we've been impacted both by extreme fires here in the Inland Empire and also by severe snowstorms. What are some of the things you may be able to share with us? What are the counties doing and sort of in preparation to try to mitigate the severe weather patterns, weather changes, weather catastrophes that are occurring and more common and more frequently?
So the Riverside County emergency response really focuses on how we can meet the needs of communities when these disasters happen. In my opinion, I think some of these disasters are kind of inevitable, right? Like as winds, as dry conditions, as all these things happen, fires happen, snowstorms happen. So really focusing on how we can provide services to those who are most needy during those situations is where we focus. And then our emergency management department really focuses on infrastructure and coordinating with emergency services providers to help mitigate and assist during those situations. That's kind of how Riverside County is structured and operates.
And if I can add to what Juan shared, I think, some of the work that Juan shared earlier around policy is how do we continue to work on policies that make these disasters, how do we mitigate that, right? And how do we try to figure out ways to look at long-term sustainment to reduce the impact of fires? Because I think as Juan shared, we are now, look at the fire insurance across the state. Is it impossible to get, certain insurances have left the state. So how do we, as one of the county agencies and the agency that looks at health and well-being for people, look at policies that can better impact and reduce some of the things that cause those downstream impacts to climate. So, in addition to policy, which I think Juan shared during his presentation nicely, government agencies working across to try to ensure there's alignment around that, but also looking at how do we provide education to the people in Riverside County, because there is some personal responsibility too. And so thinking about the community programs that we're bringing around community wellness and doing things kind of in both ways and sandwiching it, right? And so looking at policies and then also looking at grassroots efforts to do some of that work, because we can't stop necessarily fires from happening, but we can stop the way fires have, spread because of the way maybe policies were for building in certain places, or how green spaces are not being used, or where the built environment may be more conducive if we build it in a certain way to withstanding certain disasters. So I think that's where we have an opportunity to focus not only on the policy level, but also on the people level, and to impact kind of the places where we live. So just wanting to highlight some of the work that, just to, elaborate a little bit more on what Juan was sharing.
Yeah, I would just echo the same in terms of the emergency response and preparedness for San Bernardino County. We operate much in the same way. But I agree with what, Dr. Tsang was just saying. I think there's, an individual level of type of intervention where we can educate and hope to get communities ready for disasters as they happen. I mean, think about how difficult that is, though, to get folks who may already have limited resources to then prepare yet even further to gather medications, documents, and supplies for a disaster. So I think there's that equity piece there, which is really hard, I think, and challenging. And I think the other piece, to your point, Dr. Tsang, and which I was sort of referencing, is our vision is to help also build capacity in local governments and policymakers, so that when we are making decisions about how we develop our communities, we're structuring them in a way that they can be more responsive, or that they are to disasters, or that they are just more climate friendly, and people aren't needing a car to go to the grocery store or to walk to school and things like that. And so, there's some longer term infrastructure type of conversations and policy conversations I think we could have, but that's our hope too, is to be involved in those spaces and to bring our partners together around that.
That's great. That's wonderful. I'm not seeing any other questions. Does anyone want to raise your hand?
This is Jasmine.
Hey, Jasmine, how are you?
Hi, doing well. This has been a fantastic session. I have learned so much. It's been amazing. You will probably hear invites from me for some of these same speakers. The one thing that I was kind of wondering about is, I loved hearing about the building resilience in school systems from extreme heat by, increasing tree canopy. I know there's been some really successful examples of that across the country. Salt Lake City, Utah has done a lot of work in that area. I am curious about smoke and how do we build resilience for our school systems, especially because, I was a parent of two children who went home from school for 5 days this year, and I am not alone. There were so many school districts that shut down, including, I think, SBC USD, Redlands, IECHA, Rialto. So many school districts shut down for an extended period of time. And I know for a lot of families that's lost income. And then their kids are at home, possibly breathing that same smoke. It's not, so how do we make sure that, our school systems have the air, to be able to do that? They have staffing support when needed. They have that kind of like built into their resilience plans. And then I'm curious if you guys are at all, the counties are at all tracking, how many days lost we're having because of smoke and for our school systems, just like we would snow days in other parts of the country, right? And if we need to shut down schools, would it be possible to, for example, add on more school days at another part of the year and have some backup days?
Yeah, so I mean, in Riverside County, we tend to collaborate pretty heavily with our school districts. And really that connection started during COVID, I think, where it really kind of grew. And we started talking to schools about air ventilation systems. And I think there is a gap there, though, in assessing how schools can keep air quality issues in mind, prepare their classrooms to be spaces where there's clean air and kind of build up their canopy coverage to help mitigate some of those issues. As far as I know, we haven't really had those conversations with the school systems yet. But I think as our partnerships expand and our projects kind of expand, we can really collaborate to kind of create a plan for how schools can operate, similarly like we did with COVID during some of these climate emergencies. And as far as I know, we're not tracking days lost, but we do have an economist on staff. And I know we have had conversations about tracking the economic impacts associated with some of the extreme weather patterns and climate issues.
Yeah, and I think, I wanted to share that I think during COVID, a lot of the schools did upgrade their, okay, I don't know the technical term, but their air filtration systems, right?
Yeah.
The HVAC or the air filtration systems, which I think helps. So I have kids in school too. And a lot of times, the schools are mitigating by keeping kids indoors, and that's bad and good, right? Because, then they're not in the outdoor spaces that they should be to get rid of their wiggles if you have a small child. So I think, Jasmine, your question is a really great question. And I agree with Juan. I think, working with the schools to better understand that, and then how do we then use our public health lens with measurements to see what that impact is to health and wellness, because the schools absolutely are measuring their lost days because that's how they're reimbursed, right? And so if it's going to impact their bottom line, absenteeism is one of the number one reasons why the districts lose money, right? And so, I know they're tracking the absenteeism. I think how they're tracking it in using kind of the public health lens of, what is impacting absenteeism. I think that's where it would be really interesting to do that and look at that. And so if you have any literature that where someone is already tracking that, and we can reach out to our school systems and see what they're doing. As Juan said, we have calls with our schools, and we have frequent touch bases with our schools. And so that might be an interesting question to pose to them and see how they're tracking and how we could partner to improve the conditions for our children in those situations.
Yeah. And the only thing I would add to that is, I also have kids in school, and I noticed that our school district pivoted at some point when they were able to have power. They did reopen, even though there wasn't much going on academically. Families and children were still able to come because it was that sort of safe space for them to be. They could still get food. They could still, be in a place that was warm. Parents could still go to work. And so I think, there's a lot of discussion around these community resilience centers and, funding to sort of build these kinds of centers. But to your point, I think maybe schools could maybe serve in that capacity potentially. But I think that takes work across silos, with our education system and our emergency response and planning systems and public health for sure. So that's a great question.
Thanks. Yeah. And are we building kind of, in addition to cooling centers, I know, which are so critical, are we building, creating centers where people can escape smoke from their homes and, folks who are kind of more vulnerable, just like with the heat?
Definitely something to work towards, perhaps, as part of this dialogue. So I think we're going to wrap it up. Dr. Sanchez, do you want to take us out today with some final remarks?
No, thank you. Thank you so much. It's fantastic talk. I think each time I'm impressed by the quality of our speakers. I'm impressed by the quality of education we're getting and information. I think this last question brings about some interesting questions that we want to answer is how do we get involved in policy? How do we actually dictate policy? Because it impacts in so many ways. It's not just about sort of climate change, what people think about, but how it sort of mitigates everything into our everyday lives. And this gives me an opportunity to plug our webinar that we're going to get next week about, or in next month, on the real impacts of climate health on our health. We're going to have two fantastic speakers, Dr. Lisa Patel, Executive Director of the Medical Society of Consortium on Climate Health and Health. She's a clinical assistant professor at Stanford, and Dr. Ashley McClurd, Executive Director of Climate Health now here in California. And then we're also going to have our in-person conference in which we're going to actually hoping to get policymakers, our own policymakers there to start, so we can start asking those questions. What is the policy that's important to us? What are the policies we want to implement and how we can help do that? So again, thank you so much for coming. Thank you so much to the San Bernardino County Medical Society, to the Riverside County Medical Society, to both public health departments here in San Bernardino and Riverside County for forming this coalition and helping us move things along and educate our communities here. We look forward to our next webinar on March the 5th, I believe. Please
Right.
join us. Please send out to anybody who's interested in climate all this information. We're more than happy to share all the slides to everyone. We're more than happy to bring more partners into this umbrella, and we look forward to seeing you again next on March the 5th. Thank you. Have a great day.
Thank you.
Thank
Thank
you
you.
all so much. Bye-bye.
Everyone.